Did you know that heart disease is the leading cause of death globally? It also exceeds deaths from cancer and road accidents. In the United States, one person suffers a heart attack every minute. There are around 17 million deaths every year, hence around 6 million die before arriving at the hospital. These numbers are currently increasing, especially among young people and women. Surprisingly, 1 in 5 women is at risk of experiencing a heart attack. In today's video, we will address a vitally important topic: the 7 heart attack symptoms that could appear a month earlier. So, keep your attention and stay tuned till the end. Because in addition to discovering the often unknown symptoms that precede a heart attack, we will also share the factors that contribute to the alarming increase in heart attacks among people under 40. But before we get started, make sure to subscribe to our channel and turn on notifications so you don't miss any upcoming health videos. Ready? Let's begin. Symptom number 1. Tiredness or shortness of breath. A critical signal, especially for women. Have you ever had experience with this symptom? 70% of women who had a heart attack reported feeling fatigue or shortness of breath in the days or hours before the event. This fatigue is not to be confused with normal tiredness, but is similar to flu-like fatigue, without cough, fever, or sore throat. Intense weakness or muscle fatigue, especially if it is a new development within the last 30 days, requires special attention. Be especially careful if you suddenly find yourself short of breath after light activities such as walking or climbing stairs. Let's move on to symptom number 2, cold sweats and paleness. If you experience this, it may be a warning from your heart. And have you ever noticed this symptom? In fact, approximately 30% of people who have had a heart attack report experiencing this symptom in the days leading up to the event. What distinguishes these cold sweats from normal ones is their sudden onset and the sticky, cold sensation. They are often accompanied by chills on the forehead or all over the body and by a sudden paleness of the skin. This symptom can occur at any time during rest, during meals, or during daily activities. Symptom 3. Numbness in the left hand and arm. Over the past month, you have felt mild pain or numbness in your left hand and arm. Especially during activities such as walking or climbing stairs? If so, take this as a potential warning sign. While it's true that various health problems can cause such numbness, it's crucial to consider the context if this symptom is new to you. If you have the heart disease risk factors I mentioned above, and there is no other logical explanation for this sudden change, it's time to take action. If you are at risk for heart problems, seeing a cardiologist could be a vital step. Symptom 4. Jaw pain. Jaw pain, particularly on the left side, can indicate a heart problem and could be a sign of an impending heart attack. This phenomenon is linked to the nervous structure of our body, which can lead the brain to become confused about the source of the pain. If you experience unusual or persistent jaw pain, especially on the left side, consider this as a potential warning sign. Symptom 5. Back pain. This symptom is pain in the back, especially around the shoulder blade or in the lower part of the neck, especially on the left side. This type of pain could be a precursor to a heart attack or indicate a problem with the aorta artery, one of the largest arteries in our body. It is important not to dismiss this pain as simple muscle pain, especially if it doesn't improve with position changes or self-massage. Symptom 6. Digestive discomfort. This symptom is especially common among women and the elderly. It is not simple stomach pain, but it could be a pain that mimics gastritis. You may notice stomach swelling during or after meals, or pain when walking or exercising. It is essential to consider that the cause could be the heart, especially if you fall into the high-risk categories of atherosclerosis. Symptom 7. Dizziness. Watch out for sudden dizziness, feelings of faintness, or episodes of low blood pressure that appear suddenly. These symptoms, especially if they started recently and occur during physical exertion, such as walking a block, climbing stairs, or even during meals, should not be ignored. It is important to distinguish between pre-heart attack symptoms and a real heart attack. A heart attack occurs when part of the heart muscle is irreversibly damaged due to lack of blood supply. Those who have experienced a heart attack report a persistent feeling of tightness or pressure in the chest, which lasts for several minutes and does not go away easily. Additionally, a heart attack can lead to additional symptoms such as nausea, vomiting, feeling generally unwell, shortness of breath, or an intense feeling of impending danger, often accompanied by cold sweats. The critical difference between a pre-heart attack and an actual heart attack is in duration and severity. A pre-heart attack only lasts for a short time, usually 10 to 15 minutes, and improves rapidly with rest, sitting, or taking a vasodilatory tablet under the tongue. If you have experienced any of these symptoms, consider them not only as warnings of potentially blocked arteries, but also as a reminder that there is still time to act and save your heart. At the first sign of these symptoms, it is imperative to seek medical attention immediately. Go to the emergency room, call an ambulance, and inform a family member. Remember that when it comes to your heart, every second counts. Over the past 15 years, hospitalizations for heart attacks in people under 40 have increased by more than 60%. Particularly in women, with an increase in deaths of more than 10%. This increase is linked to the increasing prevalence of atherosclerosis in young modern life, which makes many activities more convenient but has its drawbacks. Heart attacks can be prevented simply by changing some lifestyle changes. If you smoke, do everything you can to quit. Quitting smoking can reduce your risk of a heart attack by 30%. Keep your blood pressure under control. If you are diabetic, make sure your blood sugar levels are well managed. Adopt a healthy diet to significantly reduce cardiovascular risk. Limit ultra-processed foods and increase your intake of fruit, vegetables, and whole grains. Cut back on sugar and incorporate more olive oil into your meals. If you have high cholesterol, seek treatment. If you are dealing with obesity, make weight loss a priority. Leave the chair and embrace physical activity. Make sure you sleep well, aiming for 7 to 8 hours a night, and get regular cardiovascular checks. Cardiovascular diseases should not be among the leading causes of death globally, yet today they occupy the first position. That's all for today, and know that your involvement is important to us and helps us a lot to continue growing.